we're talking about psychiatric medications, there are some things that are prescribed that can be habit forming, like a benzodiazepine. So, like Xanax or Ativan, right? Or an ADHD medication, a stimulant that could be habit forming. And those would fall under the umbrella of psychiatry. And then there are also medications that are not habit forming, but that take time to titrate, meaning they take time to build up to a therapeutic dose in your system and take time to, if you go off of them, you have to sort of do that gradually. And I think, I've heard some confusion before from clients actually, and they're saying like, well, I'm on this SSRI and am I dependent on it? Am I just trading one addictive thing for another addictive thing? So could you just kind of generally, and then we're going to get into some of the specifics, but just kind of talk a little bit about that, like a habit forming medication versus a psychiatric medication that's not habit forming but takes time.
Yeah, absolutely. And that's a great point. So, while most psychiatric medications are not inherently addictive, there are some, as you mentioned, such as benzodiazepines and stimulants that can be addictive. And what I would say is the reason we start low and then we build up in terms of dose. And that's the same way we kind of get off of a medication. So while a person may not be dependent upon something like an antidepressant, the reason we kind of get off of it slowly is because that person's body has become used to the medication. They're adjusted. So the way to get off of it slowly would be to avoid any withdrawal effects that may happen just from, your body being used to medication, slowly getting off of it, and just to avoid kind of discomfort. Also, sometimes there's a period when you get off medication. If you go very quickly, just like cold turkey, you stop something you've been on for a while, symptoms may come back very quickly due to the fact that you didn't slowly get off of it and allow your body to adjust.